Hello everyone, this is Dr. Sam and this video is about mammography. Mammography is a specialized imaging modality used for breast imaging using X-rays. Mainly two types of views are taken, the mediolateral oblique view and the craniocaudal view. Both these images are of a normal breast. The normal breast appearance on mammography can be different. Its appearance is based on its density. Some breasts will appear bright, that is radio-opaque, whereas others will appear dark, that is radiolucent. This appearance is based on tissue composition of the breast. The age of the woman can also affect breast appearance or breast density. Younger patients usually have denser breast. Denser means brighter, radio-opaque, whereas older patients may have more fatty breast and they will have a darker appearance, a radiolucent appearance. But this is still variable. These are images of a fatty breast, which means it is a low density breast. It will appear radiolucent or it will not appear very bright on mammography because most of its composition is fat. Fat appears radiolucent, that is dark, on mammography. Factors affecting breast density include age, hormonal changes, genetics, body weight, and menstrual cycle. Pathologies are much easier to locate in a fatty breast. BI-RADS stands for Breast Imaging Reporting and Data System. It is a standardized reporting system used to categorize mammographic, ultrasound, and MRI findings based on their severity. It has 7 categories from 0 to 6. A category 0 or a 0 score is given to an incomplete breast examination. A BI-RADS 1 score is given to a normal breast, such as these images. Both these images are BI-RADS 1 because they are normal. It is negative for any pathology. There is no significant finding and just routine screening is recommended. This is the breast tissue composed of fat, milk ducts, and connective tissue. These radio-opaque lines throughout the breast are Cooper ligaments. These Cooper ligaments provide structural support to the breast. This radio-opaque structure is the pectoralis major muscle. This muscle is seen in a MLO view. It is usually not seen in a craniocaudal view. These are normal images of dense breasts. Their appearance is very bright, radio-opaque, because they are composed of high amount of glandular and connective tissue. Glandular and connective tissues are dense and they appear bright on X-rays. It is difficult to locate pathologies in a dense breast because they get obscured by these dense glandular and connective tissues. These are mediolateral oblique views. In elderly women, you may find arterial calcifications on mammography. They will appear as bright, radio-opaque calcified arterial walls. These linear structures are the calcified arterial walls. These are benign findings. Now we will compare the normal image of the breast with pathologies. The first pathology here is a hamartoma, which is also known as A fibroadenolipoma. It is a benign tumor of the breast. On mammography, it may appear as a well-circumscribed mixed-density round mass with a bright radio-opaque capsule. This image is in craniocaudal view. A mixed-density mass is present with a bright radio-opaque capsule. This type of appearance is also termed as breast within a breast appearance because this mass itself looks like a breast which is inside this larger breast. These type of lesions are given either BI-RADS 2 or BI-RADS 3, but usually it is given BI-RADS 2, benign, a non-cancerous finding. Routine screening is recommended to monitor its size. A lipoma is another benign tumor which is mostly made up of fat. On mammography, a lipoma usually appears as a radiolucent mass, a well-defined round or oval mass which will be dark because it is made up of fat and fat appears radiolucent in a mammogram. Usually it will have no calcifications. Lipomas are given BI-RADS 2, which is benign, a non-cancerous finding, and routine screening is recommended. This is another image showing a lipoma. We can see a radiolucent dark mass with smooth borders. This is the lipoma. In this image, we can see a large radiolucent mass with smooth borders. It has benign features, so it is labeled as BI-RADS 2. This was a lipoma. This is an image that shows an intramammary lymph node. Normal breast lymph nodes will have a radio-opaque, bright structure with radiolucent center or peripheral area. The lymph node will have a small gray area, usually in the center or its side. This is a feature of a normal lymph node on mammography. It will be well defined and circumscribed with no irregular margins. Intramammary lymph nodes are given a score of BI-RADS 2. This is another image showing an intramammary lymph node. It is a radio-opaque structure with a radiolucent dark center. It does not have any irregular margins and is well defined. Axillary lymph nodes can also be seen on mammography. The image on the left shows a normal axillary lymph node. Similar to intramammary lymph nodes, axillary lymph nodes will also appear as a radio-opaque structure with radiolucent center or periphery. Here we can see a bright outer structure with a darker center. So this is a normal axillary lymph node. It is well defined with no irregular margins. Over here we have a suspicious axillary lymph node. It is enlarged and has higher density, meaning its brightness has increased as compared to the normal axillary lymph node. Also, it does not have a radiolucent center or periphery. There is loss of radiolucent central fatty hilum. They may also have calcifications. So these type of lymph nodes are suspicious and require further evaluation. In this image, we can see a suspicious calcified axillary lymph node. It has various microcalcifications along with loss of central fatty hilum. Fat necrosis is a benign breast condition in which round, firm lumps are formed by damaged or degenerative breast tissue. It usually presents in patients with breast injury due to breast surgery, biopsy, or trauma. They have a variable appearance on mammography, so diagnosing fat necrosis can be challenging because some features appear as malignant masses and further evaluation is required to rule out malignancy. Fat necrosis can also appear as oil cysts, which are round or oval, radiolucent areas with thin, radio-opaque, bright rims. Oil cysts form when necrotic fat tissue liquefies and is encapsulated. This is another case in which this type of lesion was seen. It has a round, oval, mostly radiolucent mass with thin, radio-opaque rim. This was found to be fat necrosis. This is another image of fat necrosis. Patients with fat necrosis will usually have a history of breast biopsy, surgery, or they may have some sort of trauma. So if they have such history and you see this type of lesion on mammography, it is most likely fat necrosis. Some cases of fat necrosis may have calcification. These are macrocalcifications. The calcification pattern may include coarse or eggshell calcifications, which will be seen as peripheral calcifications, hence the term eggshell. These type of calcifications can be seen in fat necrosis. This is another case of fat necrosis with calcification. We can see a large calcified mass suggestive of eggshell calcifications. Scoring fat necrosis can be difficult because they have a variety of appearances. BI-RADS 2 is given if there are well-defined oil cysts with no suspicious calcifications. BI-RADS 2 will indicate a benign finding with no further action required beyond routine screening. Some lesions may be graded as BI-RADS 3. In such cases, a short-term follow-up is required to confirm stability and monitor the size of the lesion. If a lesion has irregular borders or suspicious calcifications such as microcalcifications, or if there is any associated architectural distortion without a history of breast trauma or surgery, a BI-RADS 4 category is given. A biopsy is recommended to rule out malignancy if such features are found. A Galactocele is a benign milk-filled cyst which usually appears in breastfeeding women. This cyst is usually round or oval in shape and has well-defined margins. It is usually radio-opaque, but it can be of mixed density and it does not really have any calcifications. This type of cyst usually presents in lactating women. A galactocele may sometimes resemble a lipoma, appearing as a radiolucent mass. It usually presents as a painless lump developing over weeks or months in lactating women. So one way to differentiate a galactocele from a lipoma is that it is usually present in lactating women. and develops over weeks to months. A galactocele can also show a fat fluid level which will appear like this. The interface between two distinct densities within the lesion, seen as a result of separation of fat and fluid components that typically make up a galactocele. So you will have a lower density on one side, a darker area, and a slightly higher density on the other side. So this is a fat fluid level. Breast cysts are very common. A cyst usually appears as a round circumscribed structure which is usually isodense, or it may be brighter, that is radio-opaque, on mammography. A simple cyst is given a score of BI-RADS 2. Just routine mammographic screening is recommended. Fibroadenoma is another type of benign tumor of the breast. It appears as an oval-shaped mass. Usually it is isodense, meaning it is having density similar to breast tissues. They are smooth round masses which may sometimes be macrolobulated, which means they may have some outward bulging, some outward projection in the wall, which will alter its shape. This is a dense breast with an isodense lesion. It has similar density to breast tissues. It has the same brightness level. The mass is somewhat obscured by the normal breast tissues, but we can still see a well-defined mass with some macrolobulations. But overall it is still not very clear, so it is better to have further scans such as ultrasound or MRI if needed, which will help in diagnosis. This was also a fibroadenoma. This is another case of fibroadenoma. We can see a radio-opaque mass here. It is a round, smooth mass with circumscribed margins. Some fibroadenomas may have calcifications, especially if they are chronic fibroadenomas. In this image, we have a calcified fibroadenoma. It has radio-opaque popcorn calcifications. Fibroadenoma is usually categorized as BI-RADS 2. Fibrocystic change includes a wide variety of benign changes in breast tissue. These changes are not always considered a disease and can be seen incidentally. If they have symptoms, clinical presentation includes breast pain which gets worse during ovulation phase of menstrual cycle. Fibrocystic change also has a wide variety of appearances. Usually it includes radio-opaque, heterogeneous breast parenchyma. In this craniocaudal view, there is a heterogeneous isodense breast parenchyma with some microcalcifications. These small bright dots are the microcalcifications. Now these type of microcalcifications can raise suspicion for malignancy, so it is sometimes better to evaluate with further imaging. In this image we see radio-opaque heterogeneous parenchyma, which was later found to be a fibrocystic change. A BI-RADS category 2 is given if there are benign findings. In such a case, routine screening is recommended. A short follow-up is sometimes recommended. It is always better to have a short follow-up if there is uncertainty in diagnosing breast lesions, just to be sure you rule out any malignancy. So a BI-RADS 3 is also given to a fibrocystic change. In this image, this was a fibrocystic change, but it appeared as a spiculated mass. This mass has irregular borders. So this type of feature is a suspicious feature. Also, if there are some microcalcifications, it is better to have further evaluation. So these type of features are given by BI-RADS 4 or even 5. In BI-RADS 4 and 5 lesions, biopsy is recommended. Sclerosing adenosis is a benign breast condition in which there is excessive growth of tissues in the milk glands. There is excessive proliferation of the lobules. On mammography, a radiopaque mass may be seen at the location of the milk glands, which are in this region of breast. So here you see a radiopaque mass with ill-defined margins. This type of mass may also have microcalcifications. Sclerosing adenosis is usually given by BI-RADS 3, which indicates probably benign lesions with a short follow-up required. This usually includes a repeat mammogram in 6 months to confirm its stability. Suspicious features such as ill-defined margins and microcalcifications may lead to its categorization in BI-RADS 4. So if irregular margins and suspicious microcalcifications are seen, a score of BI-RADS 4 is given and biopsy is recommended. Intraductal papilloma is a benign tumor of the milk ducts. The mammograms are usually normal. It is difficult to locate this tumor on mammography, but in some cases, microcalcifications may be seen due to a papilloma. A papilloma can also appear as a well-defined or lobular radiopaque mass. Further evaluation with ultrasound is usually required, especially if there are symptoms such as nipple discharge or a small palpable lump, breast pain and tenderness. Keeping these symptoms and mammographic and ultrasound findings, it is usually classified as BI-RADS 4. This requires a biopsy to rule out malignancy. Duct ectasia is the abnormal enlargement of the ducts. Duct enlargement can be due to either benign or malignant conditions. It usually requires further investigation. On mammography, we will find a dilated duct arising from the nipple and subareolar region. This is the subareolar region. We can see the enlarged duct. Here is another image showing dilated duct. We can see its connection with the nipple. This connection with the nipple helps us in diagnosing duct ectasia. This is another case showing ductal ectasia. It is also arising from the nipple in the subareolar region. Here we can see ductal ectasia in craniocaudal view. We can see its connection with the nipple in the subareolar region. Neurofibromatosis involves multiple benign masses called neurofibromas. We can find multiple round or oval-shaped masses which will appear radio-opaque. We can even distinguish separate masses. This is usually the appearance of neurofibromas. This is another image showing multiple neurofibromas distributed throughout the breast. We can clearly see multiple round radio-opaque masses. Neurofibromas are usually classified as BI-RADS 3. Short-term follow-up is usually recommended, along with additional imaging such as ultrasound or MRI. Ductal carcinoma in situ is a type of breast cancer. It is a malignant condition. On mammography, it usually presents as microcalcifications. Clusters of fine linear microcalcifications are usually seen. They may have a casting, branching, or crushed stone-like pattern, which are considered malignant. Here we can see numerous microcalcifications within the breast, so these usually require further examination. In the normal image, these bright dots that you see along the Cooper ligaments are not really suspicious microcalcifications, as they are seen along the edges of the Cooper ligaments. This could be due to overlapping of Cooper ligaments or any difference in thickness of these ligaments. The malignant calcifications are often grouped together and they will align with the duct, and you will see a branching linear pattern, or they are just clustered together. These type of ductal microcalcifications are malignant. In this image, in mediolateral oblique view, we can see these microcalcifications aligning with the breast ducts. These clusters of microcalcifications, or these linear collection of microcalcifications, are considered malignant and are usually seen in ductal carcinoma in situ. Here is a magnified view showing microcalcifications along the duct. So this type of linear branching pattern is usually seen in DCIS. It is a malignant feature. Here in the normal image, these bright dots are seen at the edges of Cooper ligaments. This could be due to overlapping of Cooper ligaments or due to their difference in thickness. But over here we can clearly see microcalcifications in a typical branching linear pattern. Comatocarcinoma is a very aggressive type of ductal carcinoma in situ, and it has this type of appearance. These are clustered pleomorphic microcalcifications, which means that the microcalcifications are of different sizes and they are grouped together, aligning with the duct. DCIS can also appear as a spiculated mass, which is a mass with irregular margins. We can see irregular margins around the mass, so this is a malignant feature on mammography. This image shows a craniocaudal view, and we can see the spiculated mass. The irregular margins can be clearly seen. These type of features are given a score of BI-RADS 5, spiculated mass and suspicious microcalcifications such as clustered, linear, branching, pleomorphic microcalcifications are all classic malignant features. This suggests 95% probability of cancer and biopsy is recommended. Invasive ductal carcinoma is the most common type of breast cancer. On mammography, it may appear as a round mass, a round radio-opaque mass with irregular margins. The mass is round, but it has spiculated irregular margins. Here is a craniocaudal view showing a spiculated radio-opaque mass. The spiculated mass is a sign of malignancy. These type of features are given a score of BI-RADS 5. Immediate biopsy and management planning are recommended. Skin thickening can be seen on mammography as well. This is the normal skin. It is just a thin bright line. But in case of skin thickening, there is increased density of the skin. We can see a thicker radio-opaque line. The skin appears whiter compared to surrounding skin. The skin in this region is of normal thickness. This is a mediolateral oblique view and we can see the skin thickening here. There is a thick white line representing thickened skin. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.